Get your gear ready. This is a Sherpa's Guide to Innovation. April showers bring May flowers, and what do Mayflowers bring? Pilgrims! This is your host, Ben Tingy, and you're listening to another installment of A Sherpa's Guide to Innovation, a podcast dedicated to guiding you along your innovation expedition. Today, we're talking about the Health Datapalooza conference hosted by Academy Health. Last month, attendees gathered in Washington, D.C. for the 10th anniversary Health Datapalooza for meaningful collaboration and face-to-face conversations about the big ideas, big opportunities, and policy hurdles for improving health and health care. So what is Health Datapalooza? As described on the website, Health Datapalooza has become the gathering place for people and organizations creating knowledge from data and pioneering innovations that drive health policy and practice. Sitting at the nexus of ideas, evidence, and execution, Health Datapalooza is where federal policymakers and regulatory leads take their seats beside the health system's chief officers, information, medical, innovation, Silicon Valley startups, data gladiators, and patients. More than a meeting, Health Datapalooza is a diverse community of big thinkers and roll-up-our-sleeves-and-get-it-done problem solvers who share a mission to liberate and use data to improve health and healthcare. As with most of our conference recap episodes, today's episode will be a little like first grade sharing time. You'll hear about the stories and experiences from a variety of Atrium Health teammates who attended the conference, beginning with our very own EVP and Chief Strategy Officer, Dr. Rasu Shrestha. But first, a friendly reminder to our listeners, please subscribe to our podcast and then share your favorite episode with a friend or colleague. Did you go to Health Datapalooza? Tell us about your experience and we'll compare notes on LinkedIn or Twitter. Use the hashtag InnovationEngine and don't forget to give us a 5-star rating and a review. And now it's time to hear from Atrium Health teammates about their experiences at Health Datapalooza. I'm speaking with Dr. Rasu Shrestha, EVP and Chief Strategy Officer at Atrium Health in his office about the Health Datapalooza conference. Thanks so much for speaking with me, Rasu.
Absolute pleasure to talk to you about something that I absolutely love. So, pleasure to be here.
Wonderful. Thank you so much. So this is the 10th anniversary of Health Datapalooza, and you've been involved for the last few years. What reflections do you have about its impact over these past 10 years?
You know, it's really interesting. I've watched the Health Datapalooza grow in the last decade from what was really a significant yet a small but a very energetic meeting 10 years ago when we had Todd Park really leading the charge, and he was chairing the Palooza way back then, to now, 10 years after, where for the second time I've had the pleasure of co-chairing the Health Datapalooza. And it's really come a long way, and in many ways, Ben, it's reflective of how we have progressed as an industry here in healthcare, not just in how we're leveraging health IT in really pushing the boundaries forward of transforming healthcare, but even in how we're actually looking at what Health Datapalooza is all about, which is the intersection of public, private, and policy. And that's one of the things that I'm most passionate about at Health Datapalooza is, unlike other conferences that we go to, unlike other meetings where, you know, we have like-minded individuals, and these are important meetings where we go in and we talk about clinical care, or we go to a policy conference and talk about just policy, or we go to an investment conference like JP Morgan and talk about, you know, the balance sheets and talk about performance from a financial perspective. And we go to all of these different meetings, yet change only happens at the fringes. Change only happens at the crossroad, these intersection points. And that's what excites me most about Health Datapalooza. So a lot has happened in the last 10 years, but what's most exciting is in the last several years at least, I've seen a tremendous coming together of these different cross points at that intersection point, right, at those fringes. So we've been braver in the policy sectors to actually bring in input from health systems like ours here at Atrium Health, from payers, from the private sector, from others as well at the state level, from patients, from clinicians, from hackers, and from investors and all of that. So really evolved from what it was 10 years ago, which was really an opportunity to talk about the power of health data. It then transpired into various ways in which health data was liberated and celebrated, in how it was liberated or what was liberated, data sets that were opened up for folks to get to and really do things with, to today where it's all of that and more, with, as I mentioned, sort of the coming together. And what was most important this year was not just the fact that, like last year, we were talking about how we were coming together through all of these different intersection points, but now how we're doing together, how as a result of us actually putting our best practices, our aligning our incentives, aligning our values, aligning our sense of urgency, we're actually doing things together. So very excited about where we are right now, but equally also excited about where we're going.
Yeah, a very cool evolution from what could be to what is. Very,
Absolutely.
very exciting. So you participated on a panel about a topic that I know that you're very passionate about, women in leadership. What can be done to better support and develop women in innovation and data leadership in the healthcare industry?
I felt very fortunate to be the quote-unquote token male in a very powerful panel of women leaders that I respect tremendously. And so, the discussion was about leadership. It wasn't just about women in leadership. Right. But it was really interesting for me to, be in that panel, primarily because what came out of that panel for me in particular was the fact that despite the different types of leaders that we had on the stage there, the different traits, the different attributes, the different, levels of experiences across the board, there were common threads that really, binded us together. And I was really surprised about that. One thing in particular was how every one of the leaders had a story about their journey. What made them who they are. How they started off their journey, possibly in ways that they couldn't even have fathomed in how also their journeys would have taken them to where they are today. And then the other element there was really around this notion of servant leadership. And I knew that there would be elements of that, given that a lot of the leaders were or are public servants, doing things for the community, for the state, for the federal government, for various sectors. And I was there from a health system perspective, a health system that's doing a lot for the communities that we're serving. But this notion of servant leadership really came across as well. And it was interesting to hear, what that meant for each of the different leaders across the board. So leadership isn't just about leading the charge and making sure that you're seen at the forefront of the teams that you're involved with. It's also about serving. It's about making sure that you're able to connect to the passion, connect to the purpose, and making sure that you're able to enable others around you and find and grow those leaders around you as well. So that was the one thing that I really took out of that conversation.
Outstanding. Well, this year, Atrium Health was proud to also provide the Patient Scholarship Program. So tell us about the impetus behind the decision to bring patients to the conference, not just Atrium Health teammates.
So I was really proud of the fact that we were able to have such a strong showing of our Atrium Health teammates at Health Datapalooza this year. And for many of us who went there, it was our first time. And I was taken aback by how remarkable it is that, as one of the largest not-for-profit health systems in the country, doing so much for the communities that we're already serving here, we had the opportunity to really participate in the dialogue and the discourse at a conference like Health Datapalooza. But we couldn't have done it without the patients, because we don't do that on a day-in, day-out basis, even here at Atrium Health, right? We make sure that what we're doing in the space of innovation, what we're doing in the space of transforming healthcare, what we're doing in the everyday practice of providing care to our patients is not just at the patients, but with the patients. It is for them, but it is also with them. So this notion of participatory co-creation, the design thinking elements that we embrace even in the innovation world, that's what I wanted to bring at the conference. And Health Datapalooza has been a patients-included conference for a while, but we're really proud this year to have sponsored the Patient Scholarship Program, and as a result of that had brought in so many patients that were so enthusiastic to have been there at this 10th anniversary celebration, and to hear each of their stories, to have the opportunity to shake hands with them, to hug them, to sit down and share some time with them, to listen to them in terms of why it is that they're so passionate about the things that they're actually pushing for, what they're advocating with regards to the changes that they're, it's so meaningful for them. It really is. So I think it's important to make sure that we have that North Star in the dialogues that we have, in the strategy rooms, in the boardrooms, in the clinics, but also at a conference like Health Datapalooza.
Absolutely. So, Rasu, you came home and you quickly wrote a LinkedIn article summarizing your experience, but also you issued a bit of a challenge, encouraging people not just to attend the conference and enjoy themselves there, but to go out and make sure that they do something as a result of the conference. What actions do you hope will come as a result of people's conference participation?
So it's always interesting that we go to these conferences and we participate in the panel sessions, in the keynotes. We engage in dialogue with the many others who come in to the conferences, and we share ideas, which is all great. But then we go back to our home bases and carry on with the tasks at hand. And every now and then, we reminisce about the experience that we had or the relationships that we sparked at conferences such as these. But I think it's really important to make sure that there's good follow-up. It's really important to make sure that those sparks that were ignited as a result of the conversations or those ideas that got generated as a result of you attending a session, that there is a good level of follow-up. Mm-hmm. Because without follow-up, without us actually getting deeper into the specifics of those sparks that were ignited, we'll never have the fires that will actually set the course of a newer future for all of us. Right. So the call to action here is for us to actually follow up. The call to action here is for us to actually dig a little deeper, bring some substance and meat into some of those initial conversations that we had, and to have some tangible things that we would then perhaps track over the next year. And perhaps in the 11th anniversary of the Health Datapalooza, we can all go in and say, hey, look, here's what's transpired in the last year. Here's what we did as a result of us coming together and doing together across public-private policy involving the patients. Here's some specific examples of things that we've actually done. So really excited about where we are and where we're going. But let's make that happen, right? 12 months is a very short amount of time. Yeah. But if we can actually follow through and capitalize on the energy that we saw at Health Datapalooza in Washington, D.C. this year, I think we'll be much better off, both individually as healthcare organizations and companies and leaders, but also as an industry as a whole.
Yes. Return and report. Magnificent. Well, Rasu, thank you so much for your time and for your leadership in this space. Appreciate it.
Thank you very much.
I'm here in the studio with two Health Datapalooza attendees from Atrium Health, Allison Cochran, Senior Clinical Data Manager for the Carolina Center for Surgical Outcome Science here at Atrium Health, and Jason Schneider, Senior Director of Corporate Communications. I'm eager to hear your thoughts. Jason, Allison, welcome to a Sherpa's Guide to Innovation podcast.
Hi, thank you very much, Ben, for having me.
This is awesome. Thanks, Ben.
Awesome. Thank you both for being here. Well, would you each take a minute to introduce yourselves and tell us a little bit more about what you do? Allison, let's start with you.
Sure. So I manage a team within the Department of Surgery called the Carolina Center for Surgical Outcome Science, where in addition to kind of traditional surgical outcomes research and resident and fellow medical research education, we also develop innovative and kind of novel approaches to solving surgical problems.
Excellent. Excellent. We love that word. Jason, how about you? Who are you?
It's a very deep and dark question. But in terms
who are you today?
Who am I today? Similar. So so I oversee a team within the corporate communications function that does medical and science promotion. And so we're really focused on thought leadership and really talking about the innovations that the system is doing. A lot of that focus is nationally. So we get to interact with a lot of our clinical and scientific thought leaders here, and then talking with people out across the country about what they're doing, what we're doing, how things work together, and how we can kind of share best practices and really share the Atrium Health story.
Fantastic. Very exciting. Well, question to you both. What themes or insights from the conference did you find most compelling? What has stuck with you over the last few weeks since returning from the Health Datapalooza conference? Jason, we'll start with you.
I think the biggest thing is, because I'm not a data scientist, the biggest thing was just the energy and the excitement, right? So typically, data and policy by themselves can be a little dry, right? And then you combine them and you have a certain expectation. But there was amazing energy in all of the sessions, and just in general, people really, really excited about where this particular subset is going, right? And a lot of energy and excitement about, I think, people seem to understand that we've kind of reached a tipping point in healthcare when it comes to data and information. And these are all these people, a lot of people have been at Health Datapalooza for the past 10 years. And now they've seen over the past decade, here we are at, kind of this tipping point of where we're going to go. And it's just a lot of energy, a lot of excitement, hopeful. I think that was what just kind of has stuck with me over the past couple of weeks, is just that excitement of where we can go in healthcare now.
That's great to hear. How about you, Allison?
Yeah, and I absolutely echo that. I was really inspired by all of that energy. I think the kind of overarching theme for me, the key takeaway was that there were so many themes, right? So there was something there for everybody, whether you're a clinician or, a stodgy data scientist like me, or a patient, there was a theme there for you. Even on an international level, there was international data, which I thought was interesting. I think specifically for me, the theme that I found most compelling was, this is going to be very down in the weeds, but was the use of predictive analytics in a healthcare system, because that's what we do. That's what my team does. I was just really inspired by seeing some of the examples from around the country. And whenever kind of a leader like Highmark or something is talking about what they're doing and how they're doing it, and I see that I'm not too far behind in what I'm doing, it really geared me up to come back home, come back to Atrium and say, okay, we're on the right track. We're doing something amazing. So for me, the predictive analytics and things, that was my baby. So
I think it's always great, from my experience, when we go out to different conferences and something that we're doing at Atrium is presented. So, Dr. Edy Kim was there talking about the EA pathways, and to hear people talking about that, because clinical pathways are nothing new. They're out there. Companies go buy them off the shelf. But to have one of our leaders present work that is proprietary, that was built and created and birthed here, and see people get excited about it, that always inspires me. And I love bringing that back. To your point exactly, I think, there's really, really great work going on at Atrium. And so anytime we have a chance to share it, I always get jazzed about that, because typically people might not be aware, particularly with our new name, of Atrium Health. And then after they hear something like, so tell me more about what you guys have going on there at Atrium Health. At the booth we had, in addition to the EA pathways, we had a lot of material about behavioral health integration and a lot of the work we're doing around opioid epidemic, specifically PRIMM, which is the prescription reporting. People would come by and really had great in-depth conversations about what's going on in behavioral health, what we're doing in the opioid space, and I still have actually several to-dos of connecting with people who want to learn more and make some of those connections. So to me, that's my biggest takeaway of kind of that level of excitement of sharing.
That's outstanding. And Rasu, our Chief Strategy Officer, after he came back, he wrote a LinkedIn article and reviewed and recapped the conference. But at the end, he offered this challenge where he said, it's not enough just to go to this conference and enjoy it. We got to go and do. We got to go make something happen. And you've both touched on some of the things that you're excited to do. What other things are you ready to go out and tackle as a result of attending the conference?
Well, I guess I'll start with something practical because that is my way. And out of the conference, there was that AHRQ Predictive Analytics Challenge, and I know I keep harping on predictive analytics, but out of that call, and especially after being kind of inspired that, my team is doing, things that are at that level, we are going to be, putting our hat in the ring for the AHRQ challenge, and so we'll be doing that. And I am confident that we are competitive, and so that is the practical do, right? That I'm kind of coming out of the conference, but in kind of a more intangible sense, just really pushing the envelope, right? Like really keeping that momentum behind some of these kind of crazier ideas that we have that
Love
maybe,
those.
yeah, but that maybe are harder to get your arms around or like find resources for or to find buy-in for and that type of thing, but to keep pushing them and keep pushing them forward. And so that is kind of an intangible do, but I think it's very important to kind of keep pushing that envelope.
So I think for me, because my job by nature is a storyteller, and so I think how we share and tell our story and make it understandable, I think is something that I came back thinking about as, how do we continue to get out there and talk about what we're doing to find more partners and help us make sure that we're staying on the cutting edge. And then also personally, one of the things that really resonated to me was the pink socks. Right. So I don't know if people know what pink socks are, but I don't know if they've come up on the podcast before.
Oh, yeah.
Okay. So I don't have to explain it. So I had never heard of pink socks before. Right. And I was in the green room and there were these bags and bags and bags of pink socks. And I like socks. As a guy, we're kind of somewhat limited on what we can do in business dress. So it's socks or ties or pocket
that's about
squares.
it.
Yeah, that's what we got. I was like, oh, those are really, really cool socks. And I was like, well, yeah, we're going to be handing those out. So if you want a pair, go ahead and grab a pair. Oh, great. This is awesome. Not really understanding at all what was behind it. And so I got the socks and I, brought them home and I've worn them a few times. And then I have seen the conversation on Twitter and it made me realize I don't quite understand what's behind this. So actually a couple of days ago, I spent some time Googling pink socks and reading about the founder and kind of going down that internet rabbit hole. And that has made me, one, realize I need to reach out to the people who gave me the pink socks and show my gratitude because I did, but I didn't. And so I needed to do that, but also just being very mindful of that. And so that was just as a personal takeaway. I love the philosophy. I want to wear my pink socks more often now. Now I want to go get more pink socks. So when people ask me about my pink socks,
so
I can give them my pink socks.
Yeah.
So that was just something personally that really connected with me. And again, to me, was kind of my lasting personal but also professional takeaway, that you kind of have that approach and that mentality in not just your personal but professional life. And that just created so much energy, I think. And I wish I could wear a kilt, but that's also that's probably a bridge too far.
Well, it sounds like, though, it became your due, right? So that, you got these socks and then you ended up doing the research and now you're kind of compelled to gratitude and that type of thing. So it sounds like, you got like an actual tangible due out of that.
Yeah, no, it was really, really cool.
Yeah, the human connection. Well, Atrium Health was a sponsor of this year's Health Datapalooza, our first time sponsoring, I believe. Why is the Health Datapalooza conference a good fit for us with our mission, our values, our vision? What do you think, Jason?
Well, I think because of who we are, right? So, we are the safety net hospital for our region. I think a lot of people forget about that, but that is one of the things I am most proud about working for Atrium Health is if you look at Carolinas Medical Center, it's a fantastic institution, right? With some of the best care you're going to get, not just in Charlotte, but in the region, but in the country. And it's a unique academic community county hybrid, right? So we have this very unique position within the community in terms of who we serve and who we care for. and then combine that with just the scope and the scale of our organization, we're in this very unique position where not a lot of other organizations are, right? You typically have a county hospital that's a standalone hospital, or you have a large integrated health system, or you have an academic medical school, right, or a medical institute as part of a medium to small system that's tied to, an academic system. So you don't have something that kind of takes a little bit from all three. So as the conversation about how we use data, right? How I'm going to call them customers, because healthcare is about much more about the consumer experience and the customers. How people use that data and have access to that data is a much larger conversation. We're in a unique position to have a unique perspective, and also when you look at the patient population, and you guys know this better than I do, we have a very interesting patient population. I talk about this a lot when I'm talking with national reporters, right? Because typically, when you look at especially large clinical trials, like really large phase 3 clinical trials, especially in cardiology, we can have thousands and thousands of people. Sometimes our data will look a little bit different than some of the other institutes like a Mayo or a Cleveland Clinic or a Hopkins. Nothing against those institutes, but they serve a different patient population than we do typically. Our data looks a little bit different, and sometimes we have different perspectives. So I think similarly, we're an important voice because we're going to have a little bit different perspective, right? And particularly with our commitment and our mission for all, and how many resources and true investment we've made in the areas of public health and population health, there's a very large portion of healthcare customers who have a different digital experience than you and I do, right?
Absolutely.
And so I think the important part of the conversation is how does someone who maybe doesn't have ready access to the internet, who maybe doesn't have a computer at home, who maybe doesn't have a smartphone, maybe relies on the public library or a school for their internet access, how do they experience some of the things that we're talking about and where we want to go?
And as you mentioned, those are the people that are probably not flying across the country to go to Mayo Clinic. They have to go to their local hospital. Right.
So as we talk about, taking all this data and putting it into the hands of patients and customers, that is a huge swath of people when you talk about segmentation.
Yeah, absolutely. I think, you're absolutely right. So our patient population, we take everybody, right? And so, we're not getting people, actually that's not true. We do get people that fly in from around the country to come and, certainly in surgery. For me, the kind of vision of the first and best, choice in care, I thought that as that related to Datapalooza, I was so floored and so impressed by all the thought leaders that were at that conference and all of the fantastic ideas that were all under one roof, and I just kind of try to absorb everything that I could. Because I don't interact with patients, right? I don't really get to very directly deliver care to patients. What I kind of view as my way of delivering, best care is to take all that information, go back to my office and look at all the, work on my desk and go, now how can I look at this differently, especially given, what I've learned from this conference and talking to leaders and things like that. And again, I keep using that word inspired, but being inspired by everybody that I listened to at the conference. In that way, that's kind of the way I view delivering the best patient care in my own small way, sitting in front of my desk. For me, I thought that this question that you asked was really, really interesting, and it caused me to think a lot about, that connection between, learning and thinking about innovative approaches, to in my case, surgery and delivering that best care. I thought the conference really did that a lot for me. So,
Wonderful. Well, one theme that was discussed at the conference, and you touched on it a little bit, Jason, was the idea of freeing the data and giving it to the patients and making it more accessible. And Atrium Health brought several patients to the conference through the scholarship program. So why is their inclusion so important, and what was their experience at the conference? Allison, what do you think?
Yeah, I'll let Jason talk a lot more about that kind of patient experience because I didn't get to interact, unfortunately, a whole lot with those representatives. I think, though, it's valuable to have those patients come and see kind of everything that is available, and then they can take it back and continue in their advocacy. We heard a talk by a patient who had diagnosed and cured himself through his own research because nobody else could or would help him. And that was the most, my heart was touched by that, right? Watching this guy who had a rare disease and nobody could figure out what was going on with him. And he was just pleading, please help me, please help me. He finally got tired of it and he took it upon himself and essentially became, a doctor and, and did all of that. For me, that patient experience was insightful, and it made me think a lot about, again, my whole approach is like, how do we solve problems? And so, as a data scientist, if there's one problem sitting here in the middle of the table, I'm going to approach it one way, and then the doctor sitting next to me is going to approach it in a different way. But why don't we ask also the patient, right? And so sometimes, I think there can be a little bit of an attitude of like, well, what do they know? They're just patients and, and that kind of thing. Well, it turns out they know a lot. And it turns out they have a whole set of skills that is literally any set of skills because it's the whole population. And let's ask how they may solve it is their problem. And so that made me think a whole lot about getting all of that kind of perspective on one solution.
I love it. I love it. Jason.
So I think, based on my interaction with the patients that were there, they seemed to really, really enjoy, that's the wrong word, not just enjoy, the attendance, but also valued being a part of the conversation, right? Because they weren't just there to be talked to, right? They were a part of the conversation. And I think that's a fantastic point about, there's so much more data available to people, and using my own experience where, yes, I'm, Google, oh, my shoulder hurts. Oh, I can, based on what I've read and see, I think it's this muscle. And now I can go and see, oh, maybe it's some stretching, right? Or in more serious stuff, when my parents have health issues, yeah, I go online. I probably take it a little bit further than most just because of my background and what I do. I actually go down to the citations of some of the articles and then click on the actual clinical studies, and we'll actually read the clinical trials and then, say, ask this question or go here or let's look at this. So I think, again, it's a combination of there being so much more data available, and then also just kind of healthcare is becoming more of a commodity. We've talked about it a lot just in general settings, but so many people have more choices. I was explaining this to a friend the other day about you've got, virtual visit, you've got urgent care, you've got primary care, you have, an emergency department. We want people to be thinking, knowing where to go and be more engaged in their health care. We have to have patients a part of that conversation, right? And we have to, as an industry, not just an organization, I'm not a clinician, so I can't speak for clinicians, but as an industry, we have to listen to what our customers, our patients are telling us, particularly in some of those other settings, of what they want, and how they want it delivered.
Exactly. Design with, not for, right?
Exactly.
Nothing about us without us. Very good. Well, Jason, Allison, thank you both so much for sharing your thoughts and perspectives with me today about your Health Datapalooza experience. This has been great.
Absolutely. Thank you for having me.
Thank you very much.
I'm here in the office of Dr. Edy Kim, Chair of the Department of Solid Tumor Oncology at Levine Cancer Institute at Atrium Health. Thank you so much for sharing your thoughts with me, Dr. Kim, and welcome to a Sherpa's Guide to Innovation podcast.
Thanks, Ben. It's my pleasure to be here today. I think it's a really nice venue to share information with our listeners out there.
Terrific. Thanks for joining us. Well, tell us about your Health Datapalooza experience, and looking back, what key themes emerged for you at the conference?
Well, I was frankly a Health Datapalooza virgin, so this was my first meeting. I thought it was a fascinating meeting. Normally, the types of meetings that one as a medical oncologist attends are scientific meetings about cutting-edge research, what types of studies are being done, how we're going to make advances in caring for our patients. And this is mostly either through treatments or diagnostics, and cancer has been a very dynamic field, especially over the last 5 years. this is another way where we impact the patient. These are the technology platforms, the various innovations that are being done, not just to help efficiencies with physicians or providers, but that all translates into how we care for the patient, how we share information, and how we can make those better. So I learned a lot from this meeting. I thought that everyone had some interesting ideas. It always boils down to how are we going to take these ideas and translate them in a practical manner where they can affect patient care. Yeah. And that's what I care about being a clinician.
Absolutely. Absolutely. Well, as one of the sponsors, Atrium Health highlighted your incredible work with EA Pathways, the clinical pathways tool for physicians that allows cancer patients to get access to the latest clinical trials and real-time drug approval updates, among many other things. What impact has this physician-built and evidence-based technology had on the patients that Levine Cancer Institute has been serving?
You know, my previous life was I was a medical oncologist at MD Anderson Cancer Center, and it was a great honor to work there. It's an iconic institution across the world, but I really saw some challenges in how patients could receive this type of cutting-edge information, expertise, and not have to travel thousands of miles or hundreds of miles just to come to a center, to a building. What attracted me to Levine Cancer Institute here at Atrium Health, and now it's going on my 7th year here, was the idea of a regional-based model in that you have to deliver care at the point of contact with the patient, and it can't always be a single expert or group of experts. How can we disseminate that information and really apply it to the everyday practice of medicine? And that was the challenge here. And I think EA Pathways has really been a vehicle for us to do that. What we've done is, and this is a proprietary homegrown system, it was an idea of how we could convert general oncologists, or in any type of medicine, general practitioners, and make them or have them practice subspecialty medicine. Huh. This way, I can feel confident that as a lung cancer expert myself, what I would recommend is being recommended at the point of care for these patients, and they don't have to drive 2-3 hours, park in downtown Charlotte. I mean, I love Charlotte. It's a great city, but some folks, I grew up in a small town in Indiana. We didn't want to go to Indianapolis because it was too much traffic or too much parking. So what it's really done is it's given us a electronic platform. You can access this. Any one of our providers, whether it's nurse, PharmD, ACP, MD, can access this where they're practicing medicine or at home. It's web-based, and it has everything they need to apply to practice. People forget we have really great genetic counseling, and when you're in the midst of treating somebody, it's easy to forget that there are other services: smoking cessation, molecular tumor boards, psychiatry, senior oncology. These are all services that can benefit patients, and EA Pathways reminds them of this. More importantly, it also makes our practice of medicine consistent. We use the same documents, the same order sets, the same everything across our system. So if you're being seen by one of our doctors in Shelby or Lincolnton, it's the same way we practice in Monroe, Concord, or downtown Charlotte. And that's what makes it nice. Our doctors are confident to be able to say, we practice medicine like this across Levine Cancer Institute, not you happen to see me on Tuesday and you might see somebody else on Thursday. Mm-hmm. What also gives patients opportunity is that we list our clinical trials on there. So we have clinical trials throughout our system. Again, in a busy practice day, patients may not hear about all the clinical trials, and docs, frankly, can't keep track of all of them. We can now deliver that type of innovation to patients on a daily basis where they are. And finally, what's so important is we know that if you listen to the news every week, there's a new drug or new test or something being approved in oncology. I can't even keep track of everything in a couple fields. I can't imagine how some of these docs can cover all the different areas: breast cancer, lung cancer, colon cancer. We can make changes to our pathways literally within minutes. And that's what really helps empower our providers at these regional sites, at the main sites, in order to deliver that latest technology, that latest cutting edge directly to patients.
That's terrific to hear, really the new standard of care. So you also, at the conference, moderated a panel which was entitled Physician-Built and Evidence-Based, How Electronically Accessible Pathways Put Data into Physicians' Hands. Tell us about the conversation you had with the panel and why physician-led IT systems are really optimal for clinicians and for patients.
It was a fascinating panel with several great experts. We had somebody representing the American Society of Clinical Oncology. We had someone representing Friends of Cancer Research, a really large patient advocacy organization, as well as someone from the National Cancer Institute, and then, of course, myself. And we all had pretty similar agreements that currently the electronic health record, although has helped us advance to some degree some patient care, it is not going to take us to the next level. And one of our panelists compared the current electronic health record to a Model T, in that, yes, having motorized transportation was better than horse-drawn carriages, buggies, and bicycles. But in order for us to get from a Model T to a modern-day, Chevy, Cadillac, Tesla even, we're going to need to make some changes and adaptations. And so part of the issue has been we don't think that they talk to the people on the front lines when they design some of these systems. They have become very bulky, very clunky. They take more time to put documentation in, and that's taking time away from patients and their needs. And so there was a pretty strong consensus that we need to involve the frontline workers, whether it's the nurse, the pharmacist, the ACP, the MD, and help them be part of the next generation design of what electronic technology looks like to the patient. I think that's what we have with EA Pathways is a microcosm of that, in that we had all of our stakeholders involved from the beginning and not just a few IS specialists sitting in the back room designing what would look good from a doctor's standpoint to a patient. No, we took the data straight from people, got their input, and that's how we've developed this platform that we use.
Outstanding. And I know that you are leveraging that knowledge base to then share your pathways work with other IT leaders and cancer groups across the country so that they can develop their own clinical pathways. So talk to us about this generosity of sharing this clinical pathways information with others.
When I first moved here in 2012, I just wanted our teams to work better together. And it's tough to bring together folks who practice in different locations, different styles. And EA Pathways has really served as this vehicle to be consistent and work as a team. Other people asked us how we were able to work so well as a team, how we developed that culture. And we showed them our pathways, and they thought, wow, are you going to license this? Are you going to commercialize this? We'd love to have access to this. We didn't build it with that intent. We wanted to take care of our folks, our system, our patients in this region. But now we feel some obligation to try and help others achieve this as well. So we are constantly working on this now. It's one of our priorities to see if there's a way we can help others with the technology, whether it's through licensing, whether it's through sharing of information. But at least we're putting a model out there, one that's being looked at from a health regional standpoint of delivery of care model, in which we're able to really engage our network and make it one, not as separate entities, and so that patients feel that there is a disparity of care. And more importantly, we're trying to reach further populations out there of unmet need. There are places that don't have access to clinical trials or genetic counseling or such, and our pathways are empowering our docs in these areas, these, more regional or remote areas, to deliver that type of care.
Outstanding. Well, Dr. Kim, thank you so much for your generosity, sharing your experiences with me about Health Datapalooza, and for your clinical leadership.
Thank you, Ben. It's my pleasure.
We thank our loyal listeners for your support. We have more irons in the fire, so mash that subscribe button and anticipate other outstanding episodes coming your way. This is Ben Tingey. Thanks for listening. like
back
you
at
got.
home, I started in radio.
Oh,
Yeah,
really?
it's like you are clearly a natural at this.
My first job, my first communications job was radio.
It was radio. Wow.
Yeah.
What did you do?
I started at the college radio station.
Yeah.
And like just doing tech and like doing like basic on-air reads and then kind of worked my way up. And so I had like an hour-long show once a week when I left.
Wow.
So,
That's really cool.
voice for print and a face for radio, as they say.